World Obesity Day, observed March 4th, shines a spotlight on a growing global health concern affecting more than 1 billion people worldwide. And this year's theme is pooling knowledge, taking joint action. And joining us this morning to tell us a little bit more about it is dietitian and nutritionist Dr. Janet Martin. Good morning and welcome to Bahamas at Sunrise.
Good morning.
Yeah, absolutely. Again, it's such a pleasure to have you. So we have World Diabetes Day. So tell us, how do we define obesity? What's considered obesity?
Obesity. Well, put it simply, it's just excess fat.
Okay.
An individual is carrying around excess fat that makes them more prone or at risk to develop health conditions like cardiovascular disease, high blood pressure, insulin resistance, type 2 diabetes, because fat tissue is inflammatory, so it causes inflammation in the body, which leads to illness, chronic illnesses over time. So, and fat also, puts us at risk for certain cancers, breast cancer, some types of stomach cancers. So fat tissue really is what causes a lot of problems for individuals. And that's really what is classified as obesity, excess fat tissue in the body that can cause illness in the body.
Okay. And what role does BMI, body mass index, play in determining whether someone is obese?
Yeah, so the World Health Organization determines the amount of fat someone has in the body, or obesity, using a scale called body mass index. And that's just a combination, it's a formula that we use that you take your height and your weight and you put it in a formula. Okay. So healthy weight is 18.5 to 24.9. Overweight is 25 to 29.9. And obesity starts at 30 BMI. And it goes up in increments of 5. So someone with a body mass index of 35, 40 may be considered obesity class 1. And then it goes up in increments of 5. Now, a gentleman who works out in the gym and he has a lot of muscle, he may walk in the doctor's office and he may come up with a body mass index of 30 or 35, but his fat tissue may be normal, very little fat tissue. So it's when I work with patients, I also look at their amount of fat, body fat, compared to the BMI.
Okay.
And then what is also important in determining obesity is the waist circumference. Because the larger somebody's waist is, the more at risk they are for developing cardiovascular disease, insulin resistance, and type 2 diabetes. So for a woman like us, our waist circumference should be under 35.
Okay.
For a man, like our two gentlemen here, their waist circumference should be under 40. Right. And it appears as though their waist circumferences are under 40. Right. So the larger your waist circumference is, we also do hip to waist to hip ratio. So some persons are shaped differently. So if you have a larger bottom, for instance, then you're going to be at risk for diseases of the lower body or chronic illnesses in your hips and your knees. So obesity causes so many conditions, osteoarthritis, knee problems, hip problems. So there's so many issues. And of course, there's a psychological component to obesity that is often overlooked. So everybody wants to lose the weight, but they don't want to address the underlying issues that brought them, that caused them to put on the weight. So obesity, when we look at obesity, we look at the environmental causes and genetic causes. And some of those environmental causes of obesity, lack of sleep, sedentary lifestyles. You sit at the computer all day and you very rarely get up. And when you get up, you don't do much. You go to the water cooler, you go get your lunch, you sit back down, you don't get off and go and exercise. The types of foods that we're putting in our mouths, we're snacking all the time. So those are some of the environmental, for children, what you have in your hand, they always have a iPad or TV watching, and the genetic component of obesity is something to do with our genes. A lot of women are being diagnosed with PCOS, right? Pelvic conditions, inflammatory ovarian conditions. So obesity is multifaceted, and it's a relapsing illness.
Yeah. Would you say that we have a problem here with obesity in our country? Like, what does the statistics look like for us in the Bahamas?
Okay, so I mentioned the environmental issues, right? So that in and of itself is going to cause us a lot of problems. And so what the latest statistics shows that women are responsible for the highest amount of obesity in the country, over 50%. We have a total of over 70% of our adult population who are either overweight or obese.
70%.
Yes, yes.
Wow.
And that was a couple years back. In 2024, the Bahamas was listed as the most obese country in the region.
Really?
Yes, yes. And our children are following closely behind. In 2025, the Bahamas Global School report showed that we have 21% of our school-age children who are obese. It is concerning. And as I mentioned, a lot of the environmental causes impact our obesity statistics.
Yeah. I want to understand a little bit more. You talked a little bit more earlier about it being hereditary. So somebody that's born into a family where, the parents might be obese, and so the kid is born and the kid is obese. How does that, if the kid has a mindset that, both of my parents are overweight, so therefore I'm going to be overweight. Is that the mindset to have? Can there be a change? Okay. Tell us a little bit about that.
So that we don't inherit obesity. We have problems when I talk about the genetic component, it's hormonal.
Okay.
So when patients or someone like yourself mention that maybe we inherit obesity, I say to them, we inherit the social and cultural behaviors that impact our weight, that impact our health.
Okay.
Now there are components of our genes that makes us increases our risk for developing diabetes or high blood pressure or type 2 diabetes. But certainly we don't inherit obesity.
Okay, so is it genetic?
There's a genetic component.
Okay.
Yes.
Okay.
Yes.
Okay.
Yeah.
Awesome. So what can people do? Tell us some of the, the practices. What should we be doing then for individuals that might be on that scale of obesity?
Okay. So with the World Health Organization and all of the tools that we use, I know you're going to ask me about the weight loss medication, but before we even get there, the pillars of obesity care begin with diet, the types of foods we're putting in our mouth. Remember I mentioned about the environmental impact of obesity. So, a healthy food choices, and what does that look like? Low fat, plant-based fats like olive oils, low carbohydrate, steer away from the processed and ultra-processed foods, the packaged foods, the chips, the cookies, the sodas, the juices, and increase our protein, increase our fruits and vegetables. And then the next pillar of treating obesity is fitness, is getting active, our physical activity. The American Diabetes Association, the American Heart Association recommends movement every day. lately, but it used to be 5 days a week for 150 minutes. That's 30 minutes, 5 days a week. But of course, if you have excess fat, you want to incrementally increase that until you're moving at least an hour. Children should move every single day for an hour or more, and we should be encouraging fruit and vegetables with ourselves and our children. Now, the next pillar of treating obesity is the behavioral component. And that's what I love the most, is because yes, I can say to you, eat this, eat that, move this, move that. But if you don't address those behaviors, the ABCs, yeah, the activating triggers, and the behaviors that come out of those triggers, yeah, that cause you to feel guilty, the consequences of those triggers. I say to persons, all bites count.
Yes.
And so if you're snacking all day long, obviously you're not going to lose the weight. And so how do we space those meals? And so the pillars of treating obesity begins with diet, physical activity, addressing the behavioral component. And the World Health Organization last year agreed that we should be using the weight loss medication, which I know you're going to ask about.
I want to ask, is that effective?
It is effective, and there's so many studies that are coming out. In 2017, Ozempic, everybody's talking about Ozempic, but in 2017, the FDA, the Food and Drug Administration, Ozempic was used really for diabetics.
Yeah.
Now, Wegovy, a component of Ozempic, because it falls under the grouping of semaglutide, right?
Mm-hmm.
Wegovy was then approved for weight loss for persons who are obese or overweight and have conditions. Now, the Mounjaro, is another type of weight loss medication, and that comes under the heading of trizepatide. Zepbound was approved by the FDA for weight loss, and Mounjaro for diabetes.
Right.
And so, yes, they do work, and so many studies are showing that it also improves cardiovascular health.
Okay.
And so if persons have diabetes or hypertension or conditions that can go into chronicity, then yes, they work. But they have to be done using as an adjunct, as an add-on to diet, physical activity,
We can't get away from
addressing
it,
those
right?
behaviors, and then you bring in
Yeah.
the weight loss. And we always recommend seeing someone like myself or another person who can help you with the behavioral and the nutritional component. And of course, I can't forget bariatric surgery.
Yeah.
All right.
Well, listen, I mean, this has been so informative. I feel as if we can have you on for
Yes,
another hour
yes,
to
yes,
talk about this.
yes.
But thank you for all the wonderful information that you've shared. Very insightful.
Yeah.
And I mean, we can't get away from it. Diet, exercise, and get those behaviors together.
Yes, get those behaviors together.
Thank you so much for being
having
on.
me.
Absolutely. Ladies and gentlemen, you've been watching Bahamas at Sunrise. Can't stay away from it. Diet and exercise. We'll be right back.